So nice to see you all again. And I hope you had some good training. Well, based on the pitches I heard a couple of days ago, I can assure you that it sounds like you've had good training. So yes, I won't keep you too long. So I know it's the last session, so I don't want to keep you excessively. So what I want to discuss with you, maybe as the next slide comes on, yes. What I want to discuss with you is basically where do we go from here? Okay, so many countries are looking now at a post-COVID phase. Okay, I would not dare yet call it post-COVID, but many governments are talking of post-COVID. Okay, are there lessons learned from the pandemic that we need to keep in mind? And we need to make sure that we don't lose. And how can they help us? And I think also maybe the million-dollar question that some of you have been having these past weeks that you've been training, is there a role for infodemic management after COVID? I can assure you there is, but I hope I'll be able to convince you over the next few minutes. Next slide, please. Okay, so basically the tendency, especially after 2 years of, if we can be frank with each other, public health oppression, as some sectors and some people would probably call it, there will definitely be a drive to suppress anything to do with public health, anything that was developed during COVID. But I'm sure you would agree with me that it would indeed be a pity if we had to lose all that has been developed during these 2 years. Next slide, please. So basically, how can we make sure to recycle the innovation, the innovative solutions that we have developed during the past 2 years, day and night, 7 days a week, and make use of these innovations for other public health challenges? Next slide, please. These are some points that I could think of as lessons learned and things that we have achieved, basically, I think, in most of our countries during the COVID pandemic. I'm sure you can think of others, okay? Especially those of you who are working in other public sector offices like myself. So I think it would be safe to say that we definitely managed to get public health on the agenda. Okay, we had governments considering health in all policies across all sectors: employment, tourism, infrastructure, public transport, whatever it is. We had society, so we had, if we had to widen the circle to go outside the public sector, we had the whole of society basically acknowledging that public health has a central role in most other sectors. Most of our countries developed enhanced surveillance systems to be able to keep abreast of the pandemic. Some amazing e-health applications have been developed, and I like to look back on the vaccine certificate systems as one such amazing innovation that has achieved international interoperability, which was never thought possible before. We've also seen a new vaccine technology, or rather not so new, but maybe it was limited to a very small area of medical care. And now we've seen that technology expanded to become basically one of the technologies we have most experience of. Because I think the experience with mRNA vaccines now is at par probably with the old vaccine technologies that have been used for decades. And last but not least, of course, the birth and growth, and I think to call it growth is an understatement, it's an explosive growth of infodemic management. and how this can facilitate the art of communication in public health. So let's tackle these one by one and discuss them a bit more in detail. Next slide, please. I think in most of your countries, you have seen different senior policymakers from different sectors coming together, just like this team from Fiji, and working together on one challenge. These relationships are priceless. My contact list these 2 years on my mobile phone has expanded so much, and I've got so many ambassadors on my mobile phone contact list, people in foreign affairs, people in aviation, people in tourism, people in education. I've worked hard with so many people from other sectors. These relationships are worth their price in gold. Do not lose them, because we need them to address other public health challenges. Next slide, please. Speaking of health in all policies, I don't think that any of us have had experience of such a good example of health in our policies, bigger than what we've just lived and what we're living still. Okay? That said, it's not comfortable for certain sectors to include health. So there will be efforts to exclude health from certain policy decisions. Including health considerations increases costs because you need to include security and safety. So protection of public health adds cost to certain policies, certain practices, okay? Also, there will also be some bad blood, if I can call it so, and some sectors that might have been hardly hit by public health interventions these 2 years might wish to do this in retribution to the damage wreaked by the pandemic. That said, we know that policymakers, despite it all, despite what they might say in public, are definitely more aware of the need to take on board health's feedback when they're making decisions. And we need to make sure that this insight, this awareness remains alive, and that we make sure to be able to provide that feedback whenever is required. Next slide, please. Outside the public sector, as I mentioned earlier, we have other sectors of society. We have the business community, we have tourism out there. We've developed relationships with them. Sometimes they were toxic relationships, other moments they were better, but we definitely forged very strong relationships with so many partners out there. This is just an example I'm sharing with you. You might be aware that I am heavily involved in the small countries work within the European region of WHO. And this is one initiative that was launched in Montenegro just last month, actually, where we, within the WHO Euro office, we're basically capitalizing on the relationship that has been created with the tourism sector. And we're working on a healthy tourism policy for small countries and islands. Also with the collaborating center based here at my university. So basically, it's important to keep these relationships alive and use them for new challenges. Okay, what kind of new challenges? I mean, I would not even dare to try and think of what other challenges. There are so many. I just included two here on the slides. For example, pre-pandemic, use of masks in crowded places was something that we associated with certain Asian people. You see someone in an airport wearing a mask. Yes, he's Asian. They tend to do that, and we just ignore. Now we kind of appreciate why they do that. And most people, I think, believe it or not, love it or hate it, they appreciate why masks should be used in crowded places. Okay, so maybe we should keep that insight again alive. We've also learned about protection of the vulnerable, and most societies have indeed invested in protection of the vulnerable. again, this societal responsibility, I can call it so, towards those more vulnerable in our midst is something that should be kept alive for future policies. I'm sure you can think of 1,001 other things how these relationships forged during the pandemic can actually keep bearing fruit into the future. Next slide, please. Okay, I'm not sure if it's just me being too old, but I hope many of you remember the Pokemon series. Okay, so as I said earlier, COVID is not over yet, despite efforts by several governments to even stop surveillance. Okay, so I can understand that I can support scaling down public health interventions in countries as vaccination rates increase, but stopping surveillance, I think, with all due respect, is a dumb idea. Okay, we need to keep looking, we need to keep measuring, because otherwise we will never be prepared to respond to any resurgence or future challenges. That said, many of us have developed systems for COVID, have invested into systems for COVID that have never, this kind of investment has never been seen before, I think, in infectious disease management. Let's make sure that what we have invested, what we have created for COVID can be easily adapted to new epidemics. Let's be fair, we will be seeing other infectious disease challenges in the future. I believe WHO today was discussing whether to elevate monkeypox to a public health emergency of international concern. And I'm sure we will have other infections in the future. We need to make sure that the systems, the investment we made for COVID are adaptable, are able to handle new epidemics, and don't have to be thrown out once COVID is over. Next slide, please. E-health. Okay, so I just take one example here, but in reality, many countries, I'm lucky enough to be involved in a project, again, here in Europe, looking at health information systems developed for COVID in different countries. It's amazing what people have managed to achieve, especially when it comes to e-health systems. But if we take just one example, okay, it's had its fans and it's had its haters, the digital COVID certificate, the digital COVID vaccine certificate, okay? Love it or hate it, I think you would have to acknowledge that from an e-health perspective, it was an amazing feat, okay? Just taking the EU version, for example, we've got, I believe, around 50 countries that have actually implemented this in Europe and outside Europe, as you can see from the map in the background. Many other countries have set up other COVID certificate systems. Again, the interoperability that had to be achieved to enable such a system to actually function has been amazing. Okay, and we've seen even developing countries actually managing to devise systems to do so at national level. Okay, let's keep this tempo, let's keep this momentum, and make sure that people remember how indeed e-health interoperability is possible. And let's work on keeping it and developing it further for the benefit of the patient, for the benefit of continuity of care. And it can also be secure, as we have seen, okay? We have had no data breaches around COVID certificates, no major issues around COVID certificates. I think from an IT security point of view, they have worked actually quite brilliantly. So again, that's another thought you may wish to think about. Next slide, please. Vaccine technology, indeed. I mean, we've seen mRNA grow from, a fledgling technology, mRNA vaccine methodology, from a very small niche technology to an amazing global phenomenon, okay, that has been used by every country on the globe. The picture you see there, by the way, just for your interest, are two planes from the same British company in the Second World War. The one on the right is a Gloucester Gladiator, the biplane. Okay, here in Malta, we have a particular loving relationship with the Gloucester Gladiator because that's what we started defending ourselves with in the Second World War. By the end of the Second World War, the same company, Gloucester, was actually manufacturing a fighter jet on the left. So you can see what an amazing development we've seen in 5 years of wartime experience. I like comparing the pandemic to a war because it does create unusual circumstances that people need to overcome with superhuman energy. And I think we've seen this happen with the developments in mRNA technology. I think we will be seeing much more of these type of vaccines. And I hope that finally those infectious diseases that have been neglected for so long, the neglected tropical diseases, we might have a hope at finally having vaccines against them and reducing the mortality and morbidity burden of these diseases on several of our people, amongst other things, because they have so many more applications. I have had the pleasure of seeing such vaccines in operation in cancer. It was still at research stage at that point, and again, it can work wonders. So this is a technology we definitely have to keep investing in because it holds great promise in the future. Next slide, please. And indeed, last but not least, you've been investing the past weeks in this intensive training on infodemic management. Is it useless once the pandemic is over? Definitely not. Definitely not. It has become so much more difficult to achieve effective communication in public health because there's so much happening, there's so much going on, so much interference from all sides, and the flood that we're being faced with, not only on traditional media like when I was a kid or when I was a teen, but now even the onslaught of social media, which obviously transmits all information, good or bad, indistinctly, and people just get confused, as you have learned over the last weeks. Is there a role beyond COVID? Of course there is. We will have other infectious diseases, as we've discussed. Again, I would challenge you guys who are listening to this session to try and define a healthy diet. I'm sure we will get such a wide range of colorful replies to that question because there's so much confusion out there on what a healthy diet is, because there's so much marketing material interspersed with public health material and even malicious material, all mishmashed together, confusing people's ideas, and obviously decreasing very much health literacy in the population. So there is definitely a role for infodemic management for any public health challenge that we will be facing in the future. Next slide, please. Indeed, to achieve all we've discussed, to keep public health on the agenda, to keep a whole of society approach in government, to keep your surveillance systems in place, and to ensure uptake of new e-health initiatives or future vaccination campaigns, we need to keep that communication highway clear. We need to keep actively removing the barriers, the garbage that clutter this communication highway that we need to be using, and only infodemic management can help us do that. I've said this before, and I will say it again. I don't think public health intervention can be effective if we do not deploy infodemic management in this day and age. Okay, in order to achieve the risk communication that is required around public health interventions, in order to get the people on our side to follow recommendations, we need to ensure that there is effective infodemic management happening. Otherwise, people will be too distracted to take up public health messages. Next slide. I think the next slide is the last one. Okay, so this is a quote from somebody from the States, the former US Commissioner of Food and Drugs. And I think it's a very short quote. But when I found it, I thought, wow, this is exactly what I want to harbor on, point I want to harp on in the presentation. I think most senior policymakers across the world, in your own country, have realized, even if they don't admit it, that indeed public health is an important part of national security. Okay, I don't think that many politicians, that many policymakers really believe this up till 2020. Okay, but I think now there's very good insight at political level that this is the case. We need to make sure that this is not forgotten. All right. And again, you guys, as the new infodemic managers out there, need to help in keeping this on the agenda. I think that was it from me. So thank you very much for listening to me. And thank